I'd like to go over a condition called pseudoexfoliation. Your surgeon may have mentioned to you that you have pseudoexfoliation. Now, this condition is generally painless. Often patients have no idea that they even have it and may be told that they have it at the time of their cataract surgery. It's important that you know you have this condition because it slightly impacts your cataract surgery or may potentially impact your cataract surgery. So I'm just going to, in this video, just focus on how pseudoexfoliation is relevant in regards to cataract surgery. So to understand pseudoexfoliation, we have to look at a certain part of the eye. So here is, as you've seen in my other videos, just a basic cross-section of the eye. And here's where your lens sits. Here's where the cataract sits. Now, your natural lens, which is right here, it's not free floating in the eye. It's actually attached to the wall of the eye with strings. And these strings we call zonules. We've got lots of them. And these strings are the reason why when you move your eye right and left, the lens doesn't move. It stays stable because you have these really, really strong fibers. And during cataract surgery, as you may have seen in my other videos, so just again to reiterate, the cataract is this highlighted area here. And the outline, this layer here, is the human bag. So during cataract surgery, your surgeon will use two instruments to go in and take out this cataract, break it up into pieces, and then put in an artificial lens. Now, how does pseudoexfoliation affect things or potentially affect things? Well, remember these wires, these zonules. They hold the bag in a very stable fashion. And so your surgeon is relying on the wires to be working quite well throughout the surgery so that they can easily go in, take out the cataract, break up the cataract, and then put in the implant. If the wires are not stable or they're a little bit weak or laxed, then the bag itself will be flimsy or won't be as stable. And your surgeon will notice that, and taking out the cataract will be more difficult. It'll almost be like trying to chase after a moving object. So again, in regular cataract surgery, the wires here are very strong. When the surgeon goes in to manipulate and take out the cataract, it's usually uneventful because the wires are nice and strong and the lens is not mobile. Now, pseudoexfoliation, in some patients, not all patients with pseudoexfoliation, but pseudoexfoliation is associated with something called weak zonules. So remember, zonules, weak zonules. So what does that mean? It might mean that the strings that are attached to the bag are either they're brittle or they may break with time. And so your surgeon, that may make the surgery a bit longer and it may make it more challenging. Sometimes the wires themselves can be so weak that during the surgery, the stability of the lens is lost. And so I'm just going to remove these wires. So if there's significant weakness of the bag and lens, well, then there's going to be nothing to hold it in place. And what's going to happen is that the lens is no longer supported by these wires and it will simply fall to the back of the eye and will drop down. Why will it drop down? Because of gravity. And so how it will look now is the lens is supposed to be here. Now it's all the way down here. This is what we call a dropped lens, And if that were to happen, then what your primary surgeon may still do is still put an implant in the eye. I don't want to go into the details of when they put an implant, when they don't put an implant, but the main thing is an implant can still be placed in some instances. And then you still need to go in and grab this lens. Now, cataract surgeons typically are front part of the eye surgeons, so they deal with the front part of the eye. Anytime the lens moves to the back of the eye, and this is considered the back of the eye, if your surgeon informs you that the lens has migrated to the back of the eye due to weak zonules, then he or she will refer you to a back of the eye doctor. This is a retina specialist, retina specialist. And what the retina specialist will do is they will use special equipment to go in and retrieve the lens. You cannot leave the lens in the back of the eye. It has to be removed, and it's typically removed within a few days to a week. Now, to reiterate again, not everybody with pseudoexfoliation runs into this problem. In fact, most patients with pseudoexfoliation do very well. But your surgeon will often spend a bit of time with you informing you that you do have pseudoexfoliation, and these wires that we talked about may be weak, and sometimes you won't notice it until the time of surgery. But again, most patients don't have this issue. So that's point number one about pseudoexfoliation and how it impacts cataract surgery. So there is another way that pseudoexfoliation can impact cataract surgery. So this is the second way. So this is the view of the eye looking head on from the surgeon view. Here is the iris. So this is the colored part of the eye. And behind the iris is the cataract. And if we do a cross section, here is your iris, and here is the lens. Okay? Let's just, so I'm just going to highlight this as the pupil. Okay? And this is the pupil, this is the pupil. Now, as you probably are aware, when you have regular eye exams or at the time of your cataract surgery, your surgeon will put drops in your eyes. And these drops are meant to dilate the pupil. And so by dilating your pupil, this is what's going to happen after 5 to 10 minutes. Your pupil, let's just show you a before and after, so it's pretty straightforward. So here's your eye before, here's your eye after. So before drops, here's your pupil. And then after they put drops in, your pupil will be very well dilated. Now remember, the cataract is on the other side. So this is before dilation, and then this is after dilation. You can see how much bigger the pupil is. This is the normal response. If you put dilating drops, your pupil will become much bigger, and this will make the surgery a bit easier because remember, the lens, the cataract, sits behind the iris. So by dilating, it gives you a much easier access for the surgeon to take out the cataract. Okay? Now, in pseudoexfoliation, without going into too much detail of why that happens, pseudoexfoliation is not only, so it will, the short form for it is PXF, pseudoexfoliation. So not only can it cause loose zonules, okay, like we talked about, but it can also cause poor dilation, meaning that when they put drops in your eyes, your pupil may not dilate very well. And in cataract surgery, surgeons prefer a well-dilated pupil. So it's possible that this is what your pupil looks like before the drops. Your surgeon will put drops, and he or she will come back 5-10 minutes later, and it looks just like that. So as you might imagine, if the cataract is behind the pupil, it's very hard to take out a cataract through a small little hole like that. So Again, not every patient with pseudoexfoliation will have poor dilation. Some patients with pseudoexfoliation still have excellent dilation. But if your surgeon tries and puts the drops and there is no, the pupil doesn't get any bigger, then the surgery will proceed regardless. Having a smaller pupil does mean that the surgery will be a little bit longer. Often cataract surgery can be 10 minutes, 15 minutes, sometimes shorter, sometimes longer. But if you're dealing with a small pupil, then expect the surgery to be a bit longer by 5-10 minutes. What are the options in this case? How can the surgeon operate through a small opening? Well, number one, some surgeons are very capable of taking out a cataract through an opening like that. Some surgeons prefer to mechanically dilate the pupil. And what they do during the surgery is they can use a device called iris hooks. They make small little incisions. This does not hurt. You don't feel this at all. They make 4 little incisions and they place hooks on the iris. And then as they pull on the hooks, the pupil will become very well dilated. And this method is excellent. It works very well. It's a very reliable method. So the take-home point is if your pupil doesn't dilate very well, it's not the end of the world. Your surgeon has instruments such as iris hooks that will mechanically dilate the pupil. And they'll leave it in there so they can take out the cataract. And once they're done, they take out the hooks and your pupil will go back to normal. So they take out the hooks and your pupil is back to normal and the nice new implants behind the pupil, and that's it. There are other ways. There are ring devices that your surgeons may put in, something called a Malyugin ring. But again, the details don't matter. The point is in pseudoexfoliation, you may have this poor dilation that we talked about, and that may again prolong the surgery. Now, pseudoexfoliation can cause other things like glaucoma, and I'll be mentioning that in another video, but the take-home point in cataract surgery is pseudoexfoliation can potentially complicate cataract surgery, because of loose zonules or due to poor dilation, okay? But pseudoexfoliation is on a spectrum, PXF, okay, spectrum. Some patients have normal zonules, good dilation. So even though they have, so again, I don't want you to think pseudoexfoliation means those two things. Some patients have just normal zonules and good dilation. Some patients have poor dilation, but still normal wires, normal zonules. Okay? Normal zonules. And then some patients have poor zonules and poor dilation. Okay? Regardless of the scenarios, the outcomes are still good. But your surgeon often plans for these cases, and as we talked about, if you've got poor zonules, then there are, I should say, if you've got poor dilation, there are instruments to dilate the pupil. If you have poor zonules, there are ways that the surgeon can strengthen the wires. So again, these are the wires that hold your lens in place. If your surgeon finds that they're a little bit on the weaker side, they can place an instrument called a capsular tension ring, which is this circular ring, and this will give these wires a bit more strength. Alternatively, there's another instrument called a capsular tension segment, and that's to provide support in an area that's quite weak. So if your surgeon finds that this area is quite weak, it's very weak of zonules, they can put a special instrument and then anchor it with sutures, and that will give your eye a lot of support. But again, these are just, not common scenarios. Pseudoexfoliation, in the majority of cases, the outcome is excellent, but I just wanted to highlight some of the associations in regards to cataract surgery. I hope you find this video to be useful.